Hello, my name is Dinapolis Galvan, and this is my e-learning module for nursing faculty to reduce English as a second language students' attrition. Nursing programs, as they should, are rigorous for all students. According to the National League of Nursing, the national rate of attrition is around 20%. In comparison, medical schools have an average attrition rate of about 15.7 to 18.4%. However, for nursing students that have English as a second language or ESL, the attrition rates can be as high as 85% in some nursing programs. This alarming statistic exacerbates the disparity and diversity in the nursing career, and it deepens the nursing shortage. The goal of this e-learning module is to improve faculty's knowledge about ESL students' needs, thus also increasing the faculty's level of confidence working with this population. First, we must understand what are the risk factors that affect the ESL nursing student population. Risk factors include being a male, over the age of 40 years old, first-generation college student, low socioeconomic as defined federally by the expected family contribution score used for financial aid. However, it is important to remember that low reading scores show no correlation with attrition among ESL students. They more closely correlate with poor preparation, exam taking skills, or performance anxiety. It is also important to understand what the definition of a non-traditional student is. Delay enrollment into post-secondary education, attends college part-time, works full-time, is financially independent for financial aid purposes, has dependents other than a spouse, is single parent, or does not have a high school diploma. If they meet any of these criteria, they are considered non-traditional. To identify students at risk, nursing programs usually focus solely on assessing the students. However, many studies suggest that capacitation and resources for nursing faculty plays a major role on the accuracy of the at-risk assessment. Faculty members need specialized skills to identify and assist struggling students. Faculty should be competent at measuring the students in the following: intrinsic and extrinsic motivation. This is done through self-report that should be repeated at the beginning of each semester. This is helpful to understand the student's priorities and is an opportunity to address any potential problems. Metacognitive abilities refers to the student's ability to use prior knowledge to plan a strategy to future learning tasks. The faculty member should help identify areas of improvement and reinforce their strengths. Lack of test-taking skills. First, nursing faculty must gauge the extent and nature of the student's challenges involving testing. Then, an individualized plan of action should be drafted with the partnership of the student. Lastly, knowledge of available resources. When asked about resources available, students often were not well informed about useful resources that they were accessible to within their institution. Previously, nursing programs have provided reading comprehension programs for ESL students within the nursing curriculum. As well-intended as they may have been, the evidence shows that doing so increases the likelihood of attrition in ESL students. Though more studies are needed to explain this correlation, ESL students report that the amount of information in nursing programs is vast and fast-paced, and adding a formalized program that takes time and effort away from the nursing program makes it unmanageable. In addition, studies have suggested that ESL students that have decided to pursue a nursing program, also known as pre-nursing students, should be provided with reading comprehension programs focused on nursing prior to starting the nursing curriculum. Risks assessment are fundamental for nursing programs to identify and help students that have increased likelihood of attrition. ESL students may need individualized guidance and additional resources beyond supplemental instruction, test-taking skills, and disability services. In a study, ESL students reported issues in a major area of study. Their ability to express their understanding of content in English was the report. The students consider that due to their experiences, priorities, and methods of learning, verbalizing their understanding was a challenge. Developing a mentorship program that integrates junior-senior nursing students, nursing faculty with pre-nursing and freshman students have shown to be effective at increasing the level of engagement of students, especially in the ESL population. In addition, this type of program allows the faculty to early identify any potential issues. It is important to mention that a significant barrier of this approach is that it can be time-consuming initially and relies heavily on students' participation. Thus, to institute these types of mentorship programs, the faculty must be trained and given consideration on their teaching loads. Once in place, the program can increase the nursing faculty effectiveness and decrease ESL nursing students' attrition. Overwhelmingly, ESL students reported having issues with the conventional approach to counseling. With the best intentions, nursing faculty often passively encourages students to report issues, call out on students in the middle of a class that may be hesitant to speak, and they might promote students' attendance to faculty's office hours. However, ESL nursing students are often non-conventional and are likely to respond adversely to these measures. Evidence shows that nursing students, just like patients in the community, need a case manager. The idea of nursing faculty being the student's educational case manager is a concept that nurses are familiar with. The main concepts of case management include the increased continuity, better accessibility, faculty-student relationship building, tailoring interventions to the student, support that's individualized, teaching the student how to learn to facilitate independence, and advocate for students' best interest. Training the nursing faculty in these concepts and assigning nursing students with regular scheduled meetings was reported as one of the most consequential interventions for all nursing students, but particularly for ESL students. Nursing students' ability to succeed in NCLEX examination is integral to the success of the nursing program. Consequently, it is incumbent upon the nursing programs to prepare students for the demands of such evaluation. The NCLEX examination is a timed, adaptive test which number of questions can range from 75 all the way up to 265 questions. ESL students that fail in their NCLEX first attempt reported difficulty with staying focused during the last part of the exam, anxiety related to running out of time, and lack of confidence prior to the test. Though these are common among all students, it affects ESL students at a much higher rate. Nowadays, cohorts are given standardized tests that stimulate the NCLEX experience. Though this is helpful in preparing the students for NCLEX, it does not account for the individuality of students' needs. Nursing students that are given multiple opportunities at practicing taking standardized tests that meet the individual's need report being better prepared, less anxiety, and higher passing rate.